these lights on for detent. And if somebody would grab that large cassette over there. And I need a marker with a piece of tape. Okay, so we're going to do right ribs.
Yes.
All right, I need a, you want to be my volunteer? Do you mind? All right, so we're going to mark the side of interest with ribs. And so even if we're doing bilateral ribs, we want to mark just the side of interest. That will be an indicator to the radiologist to actually kind of draw them to whichever side it is that you're looking at. So even if you're including both sides, mark the side of interest. Now, if you want to do, okay, so anterior. So I'm going to start her with PA. I'm going to put my marker right up here. So I'm going to have you put your chest right up against this for me. Now that I have her there, I'm going to raise this up so that I have about 1.5 inches above. Watch your chin. I'm going to bring this up a little bit. This is also when I shield my patient. This doesn't run around. No. All right. Now put both hands on your hips. The patient preparation is just like for a chest x-ray as far as removal of jewelry and bras and all that. Now put the backs of your hands on your hips for me. There you go. All right. Now roll both shoulders forward. Try to touch that with both shoulders if you can. Nice and straight. And come towards me just a tiny, tiny bit. Good. Right there. Good. Yep, that's good. Hold it right there. Now, take a big, deep breath in and hold it in for me. Don't breathe, don't move. Breathe and relax. All right, you did say that it was your right side that was hurting, correct? All right, so I'm gonna have you just bring this shoulder out towards me just a little bit. And I'm maintaining the center on the right side between the lateral, mid-coronal, and the mid-sagittal plane here. I'm pulling the right side away because we started because she had an anterior injury here. So we had a PA and I'm pulling the right side away. Now I'm going to have you bring this arm up to your head. I know that might be a little bit uncomfortable for you, I'm sorry. Okay, just hold it right there. And I'm going to rotate this out just a little bit this way. In your pocket. Sorry about that. That slid right into her pocket, pulling it around. All right. Okay. And again, big deep breath in. And hold it in. Don't breathe. Don't move. Breathe and relax. Okay. Take this. I didn't exchange my IR.
Look
I was
at
about
the
to say
light.
something, but I
Is the
think, for
light
example.
field supposed to be all the way up? I mean, is it supposed to be 14, 17? Oh,
Yeah.
see, I can't see that.
Well, because when your patient's there, consider that the divergence of the beam, so it's starting off, you know, this big.
Yeah, it looks
Coming
so
out of there.
tiny on her body.
Right. And the closer you are to it here, the smaller it's going to look, but as you get farther away, and because we're at 40 inches instead of 72, it's going to appear smaller, but it still is covering the
I
entire.
was like, that looks like 8 by 10.
No, it's still covering the entire field.
Okay.
But because the body is here, and then I had her rotated this way, that gives the appearance of it being really small, but it's really going to still cover that whole area.
Thank you.
Mm-hmm.